Greetings, it's New Zealand naturopath Eric Backer, author of CanXida Crusher. Thanks for checking out this video again. I appreciate your checking my channel out. I put quite a lot of time into my videos. I'm getting fantastic comments and it's just awesome to get such good feedback from so many people. So today we're going to talk about parasites, about different kind of parasites, and two in particular I see coming back quite a lot with stool testing. I'm going to talk about those right now. So one of them is called Parasites hominis, and the other one is called Dientamoeba fragilis. So they come back quite a lot. I think that quite a lot of people out there have these bugs in their system naturally. Probably 5 to 10% of the population have, bugs with names like this, like weird sort of like, space age kind of names. There's other ones out there, Pseudomonas, and the list goes on and on. There's many different kinds of parasites, but these are two common ones I see routinely in people. It's estimated that probably up to 40% of people with irritable bowel syndrome have got blastocystis in their digestive system. That's nearly half the people with some kind of a gut issue. So blasto is quite a common bug I see in many people. Lots of stool test results come back with this particular bug. And is it a bug that you pick up in tropical countries like the Caribbean or India or Africa? No. It's a bug you can pick up in New York, you can pick it up in London, you can pick it up in Paris, you can pick it up in Rome, you can pick it up in your backyard. This bug can come from anywhere. It's transmitted from person to person, and generally through poor hygiene, drinking contaminated water, playing with animals. So a lot of this really boils down to personal hygiene. So one of the best things you can do if you've got kids is to teach them how to wash their hands properly after they've been to the bathroom. And same with yourself. I do a lot of travel, national and international travel on involving aircraft. So I tend to wash my hands quite frequently. Not obsessive compulsive like an OCD person would, maybe like Michael Jackson or something like that, over the top. Washing your hands constantly, or wearing white gloves around people. You don't need to be crazy like that. But the thing is, if you're around aircraft, traveling frequently in taxis or in hotels or just public areas like banks, wherever, you never know what you're touching. So it always pays to wash your hands quite regularly. As soon as I disembark off an aircraft, I wash my hands. When I come to my hotel room, I wash my hands. So these are just safe hygiene practices that are going to stop transmission of bugs. Because all you have to do is touch your eye or your mouth or anything, and you could have, these are portal of entries. So it's basic things like that can help prevent contamination from blasto. And when you travel, you need to be particularly careful with water. And lots of people say to watch out for things like salads and fruits, to wash them and peel vegetables, and just be careful what you have. When I travelled through Asia a while ago, I can remember people offering me bottled water that in fact was filled from some local creek. And they just turned the cap on and you could see it wasn't a factory seal. So without a factory seal or that plastic wrap, don't even go there. So be particularly careful. So many people I treat who come from overseas have got blasto. They pick it up. It's a very common bug. Doctors may sometimes pick it up with stool testing, but usually they don't pick it up. They're not really good at doing stool testing in lots of different countries. So I tend to work with some good labs in the US. You can actually get stool testing done through me at a greatly discounted rate than you would pay through your doctor, because I work with a company that work directly with labs that you're not paying much more than wholesale cost. So you can contact me through ericbacker.com and I can show you how to do a stool test, and that will pick up any one of about 50,000 different parasites. 3 stool samples, so one sample, 3 samples on concurrent days is the gold standard. So how do you deal with parasites? What do you do when you get them? Do you go to the doctor? Well, you'll probably get put on something called metronidazole or Flagyl, which is a very common drug used to treat a condition like blasto. The problem with this condition is single drugs is no good. It doesn't usually work too well because you've got other bugs you're dealing with too. And I find in most cases that most patients, like 90% who get treated with metronidazole, come back and complain of the similar symptoms they had in the first place: tummy pain, diarrhea, gas, bloating, nausea, dizziness. And if it's a really severe blasto infection, you can even have blood loss. You can have lots of weight loss, severe appetite problems, lots of muscle weakness, pain in the muscles, pain in the joints, vomiting can occur. bloody diarrhea, 10-15 bowel motions a day. These things are not uncommon with major intestinal problems. You need to deal with these things, because if you don't, they can hang around for many, many years. I had a good chat with people from the Centre for Digestive Diseases in Sydney, and the success rate is reasonably okay, but the problem is these drugs cost so much money. You could be looking at a couple of $1,000s for 3 separate high top shelf antibiotics, thousands of dollars. Consider a natural antifungal product. It's going to be a lot cheaper and probably just as, if not more effective, for blasto. So I've treated thousands of patients with parasites. It's part of the reason why I developed a product called CanXida, CanXida Remove. So you'll get that at CanXida.com with an X. So the CanXida was developed not just for yeast infection. I developed it also for parasites like blasto. And the reason why CanXida is so darn effective is it's got all the right things in it. Everything in there which is going to really work. So I looked at every kind of product on the market and I put something together which I think is the ultimate anti-parasite, antifungal product. And I can verify this with doing many, many stool test results pre and post CanXida treatment. So if you look at the cost of a few containers of CanXida, it's pennies compared to the thousands of dollars you would need to spend on an antibiotic that's very hard to get, or you'd have to fly all the way from Sydney. One of my British patients spent, I think it was about £20,000 to fly to the Centre for Digestive Diseases. She had a fecal transplant. She got put on these 3 antibiotics. She felt great for 6 months, and then it all turned to custard again. All that money down the toilet. What a waste of money. She's improved on CanXida out of sight. So while I'm not trying to blow my own trumpet here, I'm trying to tell you, natural antifungal product of high quality, sustained release is going to kick butt. It's going to do a good job. It's not going to kill any of the beneficials. It's not going to cost you, you don't have to take out a second mortgage to get this product, and it's effective. Diet-wise, what are you going to do? Well, you need to eat raw garlic, crushed garlic, coconut, especially raw coconut is very good, coconut oil, oregano. Oregano is very good to take as a food, so as a herb itself. Cloves, cinnamon. There are many different foods you can eat and include in your diet. But the big one with blasto is don't eat sugar or sweet foods, soda drinks, alcohol, takeaway food, lots of bread. You're going to get a lot of problems. And you'll soon notice that some foods will create lots of pain in the tummy when you've got a parasite. And these are usually the crappy foods. So as soon as you get pain with a food, or not long after, to avoid that food. If I had a blasto infection, I'd probably focus really on a green diet, so lots of green vegetables and light proteins like fish. I'd eat small meals, probably 5 times a day, and I'd make sure I'd have small pieces of raw garlic on several occasions. I'd probably crush a small piece of garlic and insert that rectally as well, because that works very well for parasites in the lower part of the colon. So those are some good tips for you. You can also chew on pumpkin seeds. And the other tip I'll give you is to have grated raw beetroot and raw carrot. Best time to treat blasto is 3 to 4 days prior to full moon. So we've got full moon coming up in about 2 or 3 days. This is a good time to treat parasites. They seem to be most active just before full moon. Crazy? Well, not crazy. People have known this for a long, long time. So try some of those methods out and see how you go, okay? The bottom line is you don't need to spend a heap of money on parasite cleansing. It's a waste of money. One good product, do it properly, change the diet, drink plenty of good water, and rest up, and you should start coming right with the parasite. It can take a little bit of time. If you have a problem, you can always contact me through ericbacker.com. Thanks for tuning in.